Now, they're able to like request documentation, but that's about it. But I don't think, like, how can somebody who has to code the medical record not? Why do you have to ask CDI to send a query for this condition? When first of all, if you have to ask them, then they missed the opportunity to begin with, so they're not even aware.
And that's where that timing comes in.
Yes. Because in the perfect world, by the time it gets to coding, especially when you have a CDI department, it's supposed to be, as they say in the UK, done and dusted. All they should have to do is just put in those codes with everything has been addressed, but that's not the case. And especially even in mortality reviews, because even though we know like the MSDRGs are for Medicare patients, they use APR DRGs, and when you're in 3M, they calculate both. But every mortality review, they want a person to be at 4 over 4 for SOI and ROM, which is extreme. And you have to sometimes send queries to get there. Sometimes you just don't. I mean, people expire for all number of reasons. Sometimes it is what it is. But I know I've had cases where somebody I was filed on expires, and they might be like 3 over 3. But you read through and like usually like the last hour or so, it's something in there that you can query that they didn't document. Like I just needed, one time I sent a query, I needed one diagnosis, but I ended up getting like 3 from the query because he must have reviewed the documentation and then just put in some stuff. So I got this person 4 over 4 because in a lot of places they don't review cases that are 4 over 4, and for the mortality committee, they only review cases that are less because they review them to see if there was like some kind of breakdown in care that led to it. So if it's 4 over 4, you expect somebody, that's like the extreme of the extreme. So kind of like that's understandable. So they get taken off the table. So that's why you like they taught us like whenever you have a person that expired, you always want to make sure that SOI and ROM is 4 over 4. And if you can't get it, you just have to explain why or send a query to get it there. So querying is extremely vital.
Yes.
For the revenue
and again, not just for, the reimbursement. This is data.